So now we're going to go through dental analysis, looking first at juveniles' teeth and dentition and how they differ. We spoke a little bit about this earlier in terms of age at death. And then we're going to look at some of the more common dental diseases and conditions that can occur in skeletal remains, archaeological skeletal remains. As we mentioned earlier, in young juveniles in particular, the development of dentition is quite a reliable indicator of age of death up until adolescence. And what we have over here to begin with are the dental remains of a full-term infant. So as you can see, we've seen these a little bit in detail already, but these are the crowns of the teeth that have fallen out from the sockets during excavation. They're not mature, they're literally still developing, and these are the milk teeth, the deciduous teeth. As an individual grows, the teeth will continue to develop and roots will form, and they'll eventually erupt. But in this instance, this individual died around the time of birth, so the teeth obviously hadn't erupted and hadn't developed. There are certain elements that we can certainly identify on these teeth even at this stage. In some circumstances, there's a condition that I refer to in the presentation on dental analysis called enamel hypoplastic defects, where if somebody suffers some type of physiological trauma, that this can be preserved in the enamel of the teeth. And this can occur as well in utero. So literally the enamel of the tooth can preserve a line of stunting as such in the development of the enamel itself in the crown. It is more common in older individuals. It's not commonly seen from stress in utero. There are other techniques that can be used looking at the teeth of very young individuals such as this, and again I detailed these in the presentation, of where it's possible to determine from a full-term infant whether the individual was actually a live birth, whether the individual survived for even a little piece of time, and whether the birth itself was traumatic, whether the labour was traumatic. There are ways to identify whether an individual was breastfed and for how long an individual was breastfed for. These techniques are developing all the time. And as we've stressed all the time throughout this, aspects on human remains, that it's essential to recover all of these teeth for future research, because you never know how things develop further on in scientific analysis. So it's again, and these are very well preserved remains. As you can see, there's still some teeth that are embedded within the sockets themselves, as you can see there. And so that's the young infant. Moving on to the individual that's about 8 to 10 years of age. So at this stage, the individual is losing their what's called deciduous teeth, or the milk teeth as some people call them, and the permanent teeth are erupting. So you can see it very, very clearly here. These are the central incisors of the permanent dentition, and these are fully erupted. You can see here that this one is in the process of erupting. It hasn't fully reached its height that it will attain during adulthood as such. But these three teeth, are the deciduous teeth still in situ. So these haven't been lost yet. But in an individual of this age, the roots of those teeth are literally resorbing. They're resorbing back into the tooth, and they will be lost. So that's why when a child loses their milk teeth, all you get is the crown. You don't get the root of the tooth, because the root has literally resorbed away. This is the permanent first molar that has erupted, and you'll be able to see, hopefully, back here, that is the second permanent molar starting to come up through the bone, not fully erupted yet, obviously. And sometimes, you'll get the third molar erupting back there. These three milk teeth or deciduous teeth on either side will eventually be lost, and the permanent canines and premolars will erupt there. You might notice here the ridges that are visible in the incisors, and that's very common in individuals such as this, because the teeth aren't in occlusal. They're not meeting with the other teeth yet, or have only just erupted, so they haven't become worn, they haven't become smooth yet. So those ridges are entirely normal. And you might or might not be able to pick it up, but there are actually what I referred to earlier, the hypoplastic defects, the lines in the enamel. There are traces of it on those teeth in the front, but they're faint and they're difficult to see, unless you're looking very, very close up. Because, as we said, with the looking at age at death, from teeth form at a known rate. So by measuring where those defects are occurring on teeth, we can establish approximately when an individual was under physiological stress. So very often you'll get these lines in adult individuals even, but you'll be able to establish that they were under some form of physiological stress at a certain period in childhood. And very often it can relate to periods of weaning, when the foods that the child is being weaned onto aren't as nutritionally beneficial as the breast milk, and the child can suffer because of that. And you will get certain dental diseases on young individuals, but not so much, because things like caries lesions, which are where the enamel of the tooth begins to rot, these are progressive disease. That's a progressive disease, and you basically need to live long enough and to be consuming certain foods for those to develop. So younger individuals don't generally have those types of conditions. But what you will get in older juveniles in particular, and moving on, are calculus deposits, which are the calcified plaque that occurs in your teeth. We would all have, they develop naturally unless you clean your teeth, basically. So we'll see it here. So if we're moving on to an adult individual, and this individual exhibits a number of important conditions that we see very frequently in archaeological remains, and these are important, in terms of documenting the dietary past of an individual. Again, there's ways to supplement this information nowadays from looking at things like isotopic analysis, where a person's dietary habits can be traced to a certain degree in the bones and the teeth. But the teeth themselves can very much preserve evidence of dietary conditions as well. So, as I said, the calcified plaque that we mentioned just in relation to juveniles is one of the most common conditions that we see. And if you look at this tooth here in particular, there's a ridge of calcified plaque there, and that's very commonly seen in archaeological remains. In the case of this, it is on the root of the tooth itself, which again is common. It's a sign of gum disease in certain individuals, that the gum is resorbing down, and these deposits are forming below the crown of the tooth itself. You'll see very clearly these cavities in the teeth, and these are caries lesions, particularly related to refined carbohydrates, the consumption of refined carbohydrates, and these become more common in recent centuries, particularly in relation to the post-medieval period in Ireland, again when foodstuffs are being progressively more refined, the production of food, and how flour is being produced, and it's fine flour, processed carbohydrates are desirable, and it's the refinement of carbohydrates that cause lesions like this, as well as the introduction of sugar, obviously, into the diet. These are progressive, these caries lesions. They get worse with time. Eventually, they can lead to this type of thing, where all you get is the root of a tooth left in the jaw, that the entire crown has been lost. the destruction of the crown itself in circumstances like this can expose the pulp cavity of the tooth, which can ultimately lead to the development of dental abscesses. And this individual has multiple dental abscesses. You can see there's a trace there, but they're much clearer perhaps up here, where there's a very, very significant one in the left maxilla up here. The tooth is present, but it won't stay in, obviously. But a massive dental abscess there, traces of one here. You can see again, all that's left of these teeth are the crowns, and they've completely rotted away. There is evidence of inflammation along a lot of the bone around the dentition as well. You have to be careful in terms of looking at teeth like this, because teeth may become worn down or may preserve just as roots due to other factors as well, which we'll talk about in the next example. The other aspect to consider here is that there's teeth that have been lost. So we can very clearly see that there should be teeth here, because you can see the tooth sockets, but they've just fallen out, and they're difficult to stay in when they're not well preserved. But back here on the right hand side of the mandible, you can see there's no sockets for teeth at all. So this area, which should have held the molar teeth, say the first, second and third molars, these have been lost. They've either been pulled out or have been lost presumably through caries lesions or through some other something else. And eventually the sockets will completely heal over. And we'll see the consequences of that as well. The dental abscesses, I should note as well, is of significance in archaeological remains because of the implications of the abscess. It's an active infection in the dentition, which ultimately can lead to an infection essentially of blood poisoning, and can actually cause death, because there is literally no cure. There's no antibiotics, there's nothing that can stop this. And you'll very often see individuals with multiple dental abscesses, and presumably uncomfortable, to say the very least. The other thing to note in terms of the dentition of this individual is this, what's called a non-metric trait. And you'll see there's a nodule of bone here, and there's a faint vestige of it here. This is called a mandibular tors. And these are another aspect of recording in archaeological skeletons as well. And this, it can be uncomfortable, but it's not particularly significant in terms of the health of the individual. So if we move on to the next set of dental remains, again, I spoke a little bit about earlier about in terms of age at death, and looking that some of the methods of looking at age at death relates to dental wear or dental attrition. The problems with that become very clear in this individual. If you look at the mandible, you can see the teeth. So if we look at the 3 molars that are on the right hand side of the jaw, and you can see the different patterns of wear or attrition literally from chewing and the teeth rubbing off each other. And so you can see the pattern of that. But if you compare this to the right side of the maxilla, there's a very, very different wear pattern. These teeth all have the crowns still completely intact. Okay? Whereas up here in the maxilla, in the case of the first molar, the crown has completely eroded away. It's completely worn away down to the pulp cavity. So this again can lead to the development of dental abscesses, but it's for different reasons to the individual here that we previously discussed. Again, there's a massive dental abscess here in this individual that would have had significant consequences, at least for their well-being. And you'll see it even clearer on this side. Again, this is the maxilla, so it's what sometimes is called the upper jaw. And the first molar, again, is completely worn down with the exposure of the pulp cavity here, and there is actually the development of a dental abscess here. Again, there's some development of calculus below the gum line and reactive bone, which you'll very often see because of dental disease. When we talk about the tooth loss, particularly in relation to this individual, this is the extremes of it. This again is a mandible, but you can see there's no sockets left at all in the surviving bone. So this individual would have either lost all their teeth through caries, or they were deliberately pulled, or at least some of them could have been deliberately pulled. This has implications in terms of nutrition in particular, in an era when nutrition could have been compromised anyway, whether it was 100 years ago or 1,000 years ago. If somebody doesn't have teeth to chew or to bite, then their diet and what they can consume is very, very limited, and the chances of them becoming either malnourished or undernourished are significant. And this then obviously has implications in terms of their ability to resist disease and infectious diseases in particular, and it becomes almost cyclical, that if somebody isn't well nourished, they can develop other conditions which can impact again on nutrition, and it's a downward spiral. So we're going to move on now to a selection of pathological lesions that we can encounter on skeletal remains, and particularly focusing on some instances of trauma. We're going to look now at some pathological lesions that can frequently be encountered on human skeletal remains. As we've said already in some of the presentations, not all diseases impact the human skeleton, and not all pathological lesions that are present on bones can be identifiable back to a particular disease. As we've seen, a lot of them can be, some conditions can certainly be non-specific and can never be identified. Traumas, obviously traumatic insults to bones can be very telling in terms of the life history of an individual. We're going to just briefly give a hands-on look really at some of certainly the most commonly observed pathological lesions that we come across on skeletal remains, and that's degenerative joint disease, or DJD, and evidence of infection, or particularly a process called periosteal lesions that can appear on bones. So if we start over at this side with the vertebrae in particular, I've already detailed in the presentation the nature of how degenerative joint disease, or DJD, appears on skeletal remains, and it's the joint surfaces that develop porosity and can develop marginal growths around the edges. And if you look at these two vertebrae, so these are thoracic vertebrae from the spine of the rib cage as such, and on the underside here, hopefully you'll be able to see that joint surface in particular has a lot of porous lesions, and there's bone growths around the edges. Now, again, I've already detailed of how and why we record every single joint surface in skeletal remains and archaeological remains in particular, because it's about establishing prevalence rates and patterns in particular. And when we come to looking at joint disease, it is really trying to establish if there's patterns. And for example, just in very simplistic terms, in the case of these two vertebrae, the DJD is on the right-hand side of the vertebrae themselves. Whether this continues the entire way down the spine, it can be determined, and whether it's significant or not as well can be examined. There have been studies done where degeneration like this has been noted in, for example, the neck vertebrae of women in particular in the medieval period, and that has been attributed to the tradition of carrying loads on the head, as still practiced in certain Asian countries, in South America and South Africa, or African countries as well. And that puts extra strain on the structure of the skeleton and the muscle mass, etc. So ultimately it impacts the skeleton, and it's about trying to trace evidence like this and trying to build up information firstly about the individual themselves, but also in archaeological instances as to what it's telling us about the differences between, for example, females and males, or between work practices across different age groups perhaps as well. Because this relates as well to a condition that we see in the vertebrae as well, called Schmorl's nodes. Again, I detailed this earlier, but it's this depression that can be found in the surface of the vertebral body. And this is an example of herniation of the disc of the vertebra itself. So when in the vertebral column, when you have vertebrae together like this, there's a sandwich of such gel in between. You know, the bone doesn't sit on the bone. And if through, particularly it's to do with strenuous labour, that these discs can herniate, and it is particularly has been associated with, if this occurs in young individuals when the bone is still quite immature, it can result in that gel literally herniating in towards the bone itself and forming these quite smooth based depressions within the vertebral body. This condition can occur as well in adult individuals, but it results in a much more irregular lesion than this. Lesions such as this are generally taken to be indicative of somebody engaging in laborious occupations, labour-intensive occupations from a relatively young age. And again, this can be important in tracing, is it more common in females or males in a population, and aspects like that. As I mentioned, joint disease is progressive. It gets worse and worse as time goes on. And this is an example of classic osteoarthritis. These are fragments of a knee joint. So this bone is the top of your tibia or your shin bone, and this is the base of your femur, your thigh bone, so literally the knee joint. And what you can hopefully see here is the striations and the grooving, and there should be certain polishing hopefully showing up. And it's also present on this fragment of bone here as well. This is an indication that there is literally no cartilage left in that joint surface anymore. And it is bone rubbing on bone and polishing it, literally to an almost ivory consistency, to be honest. You can see here there's a big development of marginal bone as well. It's all about the joint trying to strengthen itself from the stresses that it is under. Eventually, this may progress to the stage where you can already see the porous lesions here in this one. This may eventually have progressed into the state of where all this more solid bone has been eroded away, leaving the spongy bone as such, and the joint can ultimately completely fuse into one. That's generally, that level of degeneration is generally seen in older individuals because it is quite an extreme instance. Being able to trace, again, the pattern of joint disease in an individual is important. Moving on then to another condition that we frequently see on skeletal remains, and it's what we call periosteal lesions. And this is where we get the development of bone on normal bone. And in it can be a disease in itself, or it can be as a result of a condition, a generalized reaction of the human system. So if you look here, this is the right, these are the bones of the right arm of this individual. And down here at this end, you'll very clearly see a layer of grey, quite porous bone, and you can visibly see it's lifting off the surface. And this is classic periosteal bone, periostitis, also called fibre bone. It's known as a whole different range by a whole different range of terms. It's a bone that forms when there's a fibrous layer that covers the normal surface of the bone. And if this becomes inflamed, new bone can form underneath it. Now, the inflammation could be from a variety of reasons. It can literally be because if you've got a knock, if you've got a trauma against a bone that has damaged the tissue, the bone may become, or the tissue can become inflamed and lead to this, or it may also be the result of infections in particular. In the case of this individual, it's on multiple bones. So it's on this bone. You'll see extensive deposits here, all up here in the radius, and on this side you can see how extreme it is, and also on this bone, and it's very clear as well on the shoulder blade, again as a separate layer of bone. The fact that it's grey and quite porous, and that you can visibly see it lifting off the normal bone surface, is an indication that it was active at the time of death. Because it's on multiple bones, and we know it's actually on other bones within this individual, that is generally taken as an indication that this was some form of systemic infection. We don't know what that infection was. It could literally be anything. We know it was active at the time of death. We don't know that that was the cause of death. So it's very important to be able to, first of all, in terms of recording, as to what bones are impacted, what parts of the bones are impacted. For example, scurvy can result in specific bony reactions like this in very particular parts of the skeleton. So it's important to be able to record all those details and whether the lesions are active or healed, because very often we'll get healed evidence of periosteal bone. And this is an example of a child's rib. And if you look on the internal surface of the rib, all in here, it's not as obvious perhaps, but there's also that same bone in there, that grey porous bone, but it is starting to remodel into the normal lamellar bone, as we'd call it. So that's in the process of healing at the time of death. Again, we don't know what has caused this, but it's very often seen that if you're getting lesions like this on the internal surfaces of the ribs, that at the very least it's the sign of some type of pulmonary infection or some reaction there. It could be tuberculosis, but there's no guarantee, but it's certainly some pulmonary problem related to the ribs or to the lungs that have ultimately impacted on the ribs. So we're going to move on to traumas and the various manifestations of traumas that we can come across. Fractures of various forms are, by far the most common. We will very frequently get evidence of literally accidental fractures of bones. Fractures in humans tend to have become more severe from the industrial period onwards because of machinery in particular. Nowadays, there can be quite horrendous bone fractures encountered in clinical conditions because of, for example, car crashes and various certain extreme sports can result in very severe breaks to bones. But in archaeological remains, there's an astonishing rate of recovery and endurance really of fractures that we would consider quite extreme from the modern point of view, but again, which, if you don't have modern medicine to be dealing with problems like this, then people, had other ways of resolving them. And this is an example of a left tibia, or what's called the shin bone. So part of the lower leg, so the ankle would be just here and the knee would be just here. So if we just put it together, and very often, as in archaeological bones, it has, come apart, broken apart unfortunately, but you'll see there that, approximately, 6 centimeters above the ankle, there was a break to the bone, completely broke through both bones, because there would literally have been no hope of putting, that leg into traction. The normal reaction of the body is for the muscles to pull together, to contract. So that resulted in the lower part, the foot, the ankle, being pulled back up to the left side of the leg itself. So it's perfectly healed. You can see it's healed completely over. And obviously this person would have walked with a limp. This would have undoubtedly had knock-on impacts in terms of secondary joint disease further up, perhaps in the hips and the spine, because the alignment of the body would have changed as well. But they clearly got on, they survived that trauma and got on with life. What's of note here as well is the evidence, further evidence of periosteal lesions here. Again, this grey porous bone is showing on the tibia here, very clearly active at the time of death, but probably not related to the actual fracture itself, because that fracture is quite old. This may be something else entirely, and it depends if this is visible throughout the skeleton, it may be some type of systemic infection, or maybe something more specific to that particular bone itself. What's of note, I should have, if we just go back to this one again, the arm bone that we mentioned earlier with the periosteitis, you might notice that at this end, so near the wrist, there's actually a little clump of metal attached to the bone itself. Things like this are very important to record, obviously, in skeletal remains as well. These are you come across these quite often if they're coffined burials. They may be the remains of nails to do with the coffin, or something that's been buried with the individual, or it may be something residual within the soil already to the burial. But aspects like that are very important to record as well, because it gives us further details with the burial. We mentioned healing in terms of this one. That is very clear evidence of healing, and people survived phenomenal traumas, to be honest. This is a jaw of an adult individual, and you'll see literally the right side of the jaw is absent. Now, this was recovered as what we call a disarticulated fragment. It wasn't recovered with a burial, so we are assuming the other part of the mandible was there but has been lost because it was churned up across the site. But what this is basically a break to the right hand side of the jaw that didn't heal, or did heal but didn't join on to the bone itself. So the two sides of the break have healed up completely but didn't join together. Now, the individual clearly survived for at least some time, but again, the impacts in terms of their nutritional intake could have been very significant there. And it's important to be able to record as well the degree of healing or not of a bone. Very often we'll see in ribs, because there's not a lot you can do with ribs when they break. This is I think it's the 7th rib of an adult individual. It's very near the what's called the breastbone end of the rib, and there's a break just there, as you can see. But it's what's called a non-union break, that the ribs in particular are very hard to stabilise unless, even if they're bandaged. When somebody breaks ribs, even now, they're advised not to move too much, so that it gives the rib the chance to actually knit back together. And that's what's important, is the development of this reactive bone at the margins of the break that will allow it to knit together. Now, this may eventually, if this individual had survived, it may have knotted together eventually. But in this instance, it hadn't reached that stage yet. The other evidence of fractures that we get that are called stress-induced fractures sometimes are quite a specific condition. Again, this is the vertebra from the lower spine. It's a lumbar vertebra, and this break here that you can see, hopefully, is a condition called spondylolysis. In this case, it's only on one side. Very frequently, you'll get the breaks on both sides, and it's where the lower part of the arch itself becomes separated. It has been related to particular activities. I think it can be traced in some modern athletics, certain practices. But again, if it stays like this, even if it has broken through on the other side, it's quite manageable. the problems with this arises is if this part of the bone slips, and it can cause damage to the spine itself. But these are quite frequently recorded in skeletal remains, but they're called stress fractures. You'll also get stress fractures in surfaces of joints that are under, that have tiny hairline fractures. So we're going to move on to probably some of the most vivid examples of trauma that we can get in human skeletal remains, and that's evidence of violence and sharp force trauma in particular. There's obviously a huge range of violent trauma that can manifest in remains, and it could be blunt force traumas, various aspects, but these are all examples of sharp force traumas. And just again to give you an example of the evidence of healing that we can get, this is the frontal bone or the forehead of an adult and the back of the same individual. And you can see, so this is where the right eye socket is, and the left one, would be over here. And you can see two lesions here that would have been sharp force traumas. They didn't penetrate through the cranial vault, and they have healed up. So at least 2 blows to the head from some edged weapon. There's similar lesions at the back of the skull. There's one here and another one there. You can actually see the flake of bone here separate, but again healed up. The individual survived. These are examples over here of sharp force traumas of individuals who didn't survive, and these are really important because it's about identifying violence in human populations and tracing patterns of weaponry, how weapons have changed, and I suppose the degree of violence or not that might be apparent in a population. So if we look at this skull, and I've chosen this in particular to show you how subtle some of these lesions can be, because the ones up here are more extreme. This is the left and right side of a skull. The frontal bone would be here, so the forehead would be here. But there's actually 2 sharp force weapon injuries to this individual. There's one cutting right up the side here, and there's another one at the back. There's actually another one visible on a fragment of bone from back here, but it's almost impossible to indicate it here clearly. But it's by looking at the bones very, very close up, and you'll see very sharp edges on the bones. And with traumas like this, it's very important to be able to record where they're occurring in the skeleton properly. Very often you'll get secondary fracturing. Sometimes you can identify patterns of which injury occurred first, but invariably you can't actually say what was the cause of death, even if it is a decapitation, because the individual could have been dead already. Certainly, we some injuries we know would have been fatal, but we can't say it was the fatal blow. This is the frontal bone of another individual, so from the forehead, and this is the maxilla, so part of the left dentition, and the cheekbone. So if you look first at the frontal bone here, and this will be a little bit more obvious, you'll see there's a very significant cut right through that side of the bone. So a blow right through, penetrating right into the skull. There is no evidence of healing here, as in this one. The individual did not survive this assault. There's additional injuries on this individual just here, which is the left edge of the eye socket. So it should join on here, essentially, to form the face. There's actually a slice of bone removed off that. So when we look here again, this continues down here, but this part of the cheek has also been sliced off. So we know that's at least 2 weapon injuries. There's been a blow to the front, to the forehead, and a slice down the side of the face. There's multiple injuries on this particular individual. And it was repeated extreme violence. Another thing to note about this one in particular is if you look at the colour, and I'm sure you've noticed how white these parts are in comparison to this part. These are pieces of bone that have been exposed to daylight. So they've bleached literally in the sun. This can be important in terms of tracing, looking at taphonomy and how skeletal remains can change over time from death right through to recovery. So again, recording aspects like this is very important. Moving on to our final example, and these bones are all from a single individual. This is the left ulna, so it's from this part of the skeleton, and this skeleton was partially incomplete, but when you look here at the very top of the bone, it's been sliced through. Now by recording that in detail as to where it is on the body and how the arm would have acted, because we did get fragments of the humerus as well, which would obviously form the other side of the joint. This individual would have had their arm bent like this and literally got the inside of the elbow sliced off. There's also another blow here, and you might just be able to pick up, there's an edge there, but there's a slice of bone removed, cutting down into it like this. Very often when you get slices into bones, you'll get you'll get the bone that has been literally picked up from the weapon being removed. It'll flake the bone off. Sometimes you'll be able to, for example, we had a site where somebody has a very tiny nick of a weapon, a sharp force weapon injury to the bone of the humerus up here, but we could tell from the location. We knew from the injury itself, obviously the person hadn't survived because there's no evidence of healing, but from the location of where it was on the bone, it would have cut a major artery, and they would have, if nothing else, they would have bled to death, presumably from an injury like this. And then the skull of that same individual, there's actually 3 quite significant blows, again, no evidence of healing, to the cranium. So again, this is the frontal bone, and you can see a major slice into, using presumably a sword, but there's evidence of multiple weapons being used in this individual, so possibly multiple assailants, or one individual using multiple weapons. But a complete slice through here. Sometimes you'll be able to trace tiny little defects in the blade. You'll see striations going across as the blade cuts into the bone. And that can be, that's quite distinct from saw marks which you get in post-mortem procedures. This is the remainder of that individual's skull, and this is the left side of the skull, and the right side here, and the back here. You can see there's another very significant unhealed injury there, and another blow to the head coming in on this side, resulting in fractures coming off the bone there. So again, multiple attacks to the head and to the jaw as well. There's a very significant cut right into the jaw here, which is fractured all the way across. That type of injury isn't necessarily fatal. There are certainly examples of individuals surviving. We've already seen the fracture of how someone can survive something like that. So people can survive, injuries such as that. But when you're talking about violent trauma, it tells us a lot about that particular society, and hopefully, if you have the proper date of individuals, you might be able to link it back to particular social issues that might have been ongoing at the time. So we're going to leave it there in terms of looking at pathological lesions in skeletal remains. Thank you.